Now that's usually a frequent early symptom that they go to the doctor, get a CAT scan, and the tumor discovered. And then the question comes, is this operable for cure? You know, and pancreas cancer can spread in one of three ways. One is locally, but then it can invade those arteries and veins which are right in that region. And if encases or invades the celiac axis arteries, for instance, and veins, it's considered not curable. And if it can also spread through the lymphatics, which can cause a little bit further away metastatic spread, and then can spread through the blood. Many times the patients are discovered who have the cancer in the tail, other part of the pancreas, to have back pain, that's pain that's radiating to the back, and that's usually comes from a pancreas tail mass that is infiltrating into the surrounding tissues where the nerves are in the back, but that's usually an unresectable situation.
One more general question, and before I ask a few questions about you and what you're doing here. Is there really any other way to find pancreatic cancer other than a yearly checkup, since those symptoms mimic everyday health problems?
Well, what are the risk factors? Well, many risk factors are really not all recognized yet, but what we know of pancreas cancer is twice as common in smokers than in non-smokers. And that's also true for most of the other cancers too. Smoking should be considered a risk factor or a causative somehow involved in the mutations that develop during the development of the pancreas cancer. So if people smoke less, that would probably help to get less pancreas cancer diagnosed. And besides that, repeated episodes of inflammation of the gland called pancreatitis. If patients come down with episodes of acute pancreatitis of whatever cause, that is a risk factor. Chronic inflammation is usually risk factor for cancer, and that's true for lung cancer. Smoking causes chronic bronchitis. Chronic inflammatory bowel disease like ulcerative colitis can cause colon cancer, and inflammation in the pancreas can cause pancreas cancer. But beyond that, if dietary factors are involved, is not really proven. Sometimes you hear about maybe coffee or some other diets, but that's not definitely proven yet.
Mm-hmm. Thank you, Dr. Auber. And we've heard that you're the only doctor in Morgantown, actually, who will see pancreatic cancer patients. Is that true?
Well, I'm working fortunately in a larger group of oncologists here, and we subspecialize according to the major cancer types. Now we do have lung cancer group. We have that's headed by Dr. John Rogers, breast cancer group, Dr. James Abraham and Shoba Kurian, and Dr. Kurian also working with us in the GI cancer group too. So she also available to see patients with different GI cancers like pancreas cancer.
I ask you, what is your exact medical field of discipline?
Well, I'm involved in GI cancer, GI malignancies, and that includes colorectal cancer, stomach cancer, liver cancer, small bowel, and anal cancer, pancreas cancer, but also seeing quite a few melanoma patients. And melanoma is a very fast-growing other solid tumor which unfortunately attacks young people and middle-aged people, where pancreas cancer, usually the median age is about 65 years or older. And then sarcoma patients too, which is another rare solid tumor, usually soft tissue tumor, occasionally can come from the bones. So I'm seeing those patients too.
In particular, how often do you see patients with pancreatic cancer, would you say?
Well, given the fact that pancreas cancer is increasing in incidence and it's becoming the second most common GI cancer after colorectal cancer, we're seeing them these patients more often than we used to see them like a decade ago. Maybe the doctors referring more, and with the invent of the PET scan and MRIs, we can get better image on the abdomen and refer the patients sooner. But I think the pancreas cancer truly increasing in incidence, and so we're seeing probably, I would probably say every other month